Will be on antiviral drugs. So that part of antiviral drugs, that is non-retroviral drugs. So as I'm working in Department of Pharmacology as a professor, my name is Shivleela Barawade. So we'll go through it antiviral drugs in detail, how it is acting, and what are its indications and adverse effects, and how it is useful in when cases comes, and what are the changes happen, and what are the new drugs has came as advances of the discoveries. So before going, these are the learning points or objects you should know about the classification of antiviral drugs and their spectrum of actions. So how many antiviral drugs is going to cover how many viruses that is related to spectrum. Pharmacology of acyclovir, that is prototype drug in detail you should know, and some silent features of other non-retroviral drugs and indications and details about the interferons. So these points should be covered today's class. So as we know, viral is a different from bacteria. So it proliferate when how many numbers enter into the body will proliferate, but it's dependent on the human sources. So it will attach to the human cells, and DNA or RNA is re-synthesized, and whatever the proteins is required for the covering proteins. So that also synthesized source of the whatever proteins is required, ions is required. So that will be dependent on the human cells. So these are the different steps where different antiviral drugs are going to be act. So you can say here virus one it and so there will be interferons. So there is acting interferon is having multi step or a multi site there this action is there. This cross indicates there is a inhibitors. So uncoating is inhibited by the amantadine, remantadine interferons. Protein synthesis, that is early stage, is inhibited by the fomipizin, and enzymes, nucleic acid synthesis inhibition is by the drugs which are there in the DNA polymerase enzyme inhibitors and transcriptase inhibitors. So like that assembly. So after synthesis of proteins, virus whole structure is assembled, then it is released into the blood circulation. So assembly is inhibited by the amantadine, remantadine interferons. Then their release into the circulation is inhibited by the oseltamivir, zanamivir interferons. So this is how the different drugs are acting in different sites. Whenever there is a problem with a resistance, so two drugs can be combined which are acting on different sites. So that will increases the efficacy and reduces the adverse effects, and that will prevent the increase of burden of the virus. So again, based on that steps, the table highlights the different drugs acting on different sites. The drugs which is very important one is acyclovir. So that will inhibit DNA polymerase enzymes. Again next which are important came into the market are ganciclovir, vidarabine, tribavirin, foscarnet, cidofovir. So they also inhibit DNA polymerase enzyme and inhibit the nucleic acid synthesis. Next comes reverse transcriptase inhibitors. So they are zidodine, lamivudine, ephedrine. So these also drugs available for the treatment of HIV infections. So this is how the drugs are grouped into different classes. So based on the spectrum, so which are the drugs available for the which viruses like herpes cytomegalovirus is covered by the group of drugs like cyclovir, cidofovir. Influenza viruses is covered. It is treated by the amantadine, rimantadine, zanamivir, oseltamivir, primaverin, lanavirine. So, like this, influenza virus treatment are drugs available for that. Next comes variation, that is respiratory syncytial virus. You can see ribavirin and one monoclonal antibody is there, palivizumab. So that is for the respiratory syncytial virus. So fluconazole is available for the rhinovirus and enterovirus. Then we'll go through individual drugs. In that, mainly important one is acyclovir. So acyclovir very commonly used drug for the herpes simplex virus and for the herpes zoster infections. So this before inhibiting DNA synthesis, it is converted into active form, that is mono, and then to triphosphate. That is conversion takes place in the host cells and utilization of host cell enzymes. So after conversion of cyclovir to triphosphate, that will inhibit the DNA synthesis by inhibiting DNA polymerase enzyme, and then it also interfere the chain terminations by adding in the DNA site. So there is full chain terminations takes place. There is no further DNA synthesis. And there is no viral replications, so immediate stop of viral replications take place. So this is can be given in oral route, only 10 to 30% of viability is there. 4 hourly it can be given, and food will decreases the absorptions. TRP is 3 to 4 hours and enters the CSF and aqueous humors and excreted in the renal systems. So it causes a little bit side effects related to GIT like nausea, diarrhea, headache. And when it is given rapid IV injection, it causes renal insufficiency. So the technique of injection should be slowed down or it should be diluted, and also important based on the patient condition how it is. So that will prevent the renal undergoing the damages. Next, adverse effects that is related to CNS are confusions, hallucination, agitation, tremor. So when it is applied through cream or ointment at the topical site, it will produce stinging, burning, itching, erythema sensations. Next comes when it is applied to the eyes, it will cause stinging and conjunctivitis. So these are the different indications or uses of cyclovir herpes simplex infections. You can see the is used in the form of oral, parenteral, and topical, different routes and available in the different preparations. So genital herpes 200 mg 5 times daily for 5 to 10 days, or 5% cream 3 to 4 hourly for 5 to 10 days can be given. If it is herpes, keratitis, in 3% eye ointment form 5 times a daily should be applied so that it's get faster healing, and after healing 3 days it should be continuing. Mucocutaneous herpes is a 5% cream 3 to 4 hours for 5 to 10 days. If it is encephalitis, 5 mg per kg IV either. Herpes zoster 800 mg 5 times daily for 5 to 7 days. Chicken pox, if it is 800 mg QID for 5 to 7 days. For cytomegalovirus infections prevalence or its Prevention. Prophylactic can be started this cyclovir in organ transplant patients. 200 mg 8 hours. So that's about cyclovir. Next drug is cidofovir. Cidofovir, it is derived from cytosine nucleotide. So its inhibition or mechanism of action is same as cyclovir. So it is mainly used for AIDS patient suffering with CMV, that is cytomegalovirus retinitis conditions, and that cidofovir can be. Its half life is 17 to 65 hours, but when it goes converted into metabolites, that is cidofovir phosphocholine, it's a metabolite. So its half life is 87 hours. So it's very long. So no required frequent administrations because of a long half life. So its route of administration is parenteral and topical route. So when it is given, it may produces GI disturbances, reduces neutrophil count, rashes, Fanconi syndrome, dose dependent nephrotoxicity. As the dose goes is high level, then it may produce the renal damages. Next is fanciclovir. So it is a prodrug. So it is converted into penciclovir. Again, mechanism of action is same as our cyclovir, but it will not causes chain terminations. So that is only one step DNA synthesis inhibition takes place. So it's having good viability 75% when it is administered oral route, and it given for the herpes zoster genital herpes infections, and it produces headache, nausea, and anxiety. So it is given 500 mg 8 hourly for 7 days. Docosahexaene. So it is inhibit viral entry into cell by blocking fusion between cellular and viral envelope membranes. So topical treatment of recurrent oropharyngeal herpes can be given docosahexaene. So dose is 10% cream applied on the lesions 5 times daily. Fomivirsen. Fomivirsen is again antiviral drugs that is more effective for cytomegalovirus that is resistant to ganciclovir, foscarnet, cidofovir. So that will block the early protein synthesis in cytomegalovirus. So it can be injected intraventrally for cytomegalovirus retinitis in AIDS patients. So cytomegalovirus infection in other sites like vitritis, iritis, rise in intraocular pressure, it can be given fomivirsen. Dose is 330 microgram weekly for 3 weeks intravitreally, and then every 2 weeks followed by monthly. This is a course of fomivirsen in cytomegalovirus infections. Next, very important is foscarnet. So it is active against for many viruses like simplex, zoster, cytomegalovirus, Epstein-Barr virus. Even it is effective for HIV-1 infections, apentavirus 6 and 8. So it will inhibit the DNA polymerase enzyme, RNA polymerase enzyme, HIV reverse transcriptase enzyme. So it is good having IV route is better because oral viability is very less. So preferred route is IV. So CSF entry is also good. So it is indicated for CMA, that is infections, cycloresistant simplex and zoster infections. So it produces adverse effects related to GIT, nephrotoxicity, and CNS. So that is little bit headache, hallucination, and seizures. Next comes ganciclovir. is guanosine analog triphosphorylated into triple phosphate form that will inhibit the DNA polymerase enzyme. So it is effective in cytomegalovirus, simplex, zoster, and hepentavirus 6 and 8. It is having low bioavailabilities as seen in first kernel. So its half life is 4 hours. So it is very short. But when it goes into the cell, so its half life increases to 16 to 24 hours. Attainment of CSF concentration is 50% on the serum. So that can be given in involvement of any CNS infections. So it can be treated with this calciclovir. So CME infections like retinitis, colitis, pneumonitis, esophagitis. So in all that cytomegalovirus infections, calciclovir is a good drug or a drug of choice. So it produces adverse effects mainly related to the counts, blood counts, that is reduce neutrophil counts, platelet counts, blood RBCs count. So GIT disturbances, headache is also seen with calciclovir. Next is ganciclovir, 60% oral bioavailabilities. So it produces headache, GIT disturbances, myelosuppressions. Dose is 900 mg BD for 21 days. Penciclovir, it is having active metabolite, that is famciclovir, given in IV and topical route. So it produces recurrent herpes labialis. It is used in recurrent herpes labialis infections, that is 1% grade, having cutaneous herpes simplex infection by IV route. Valacyclovir. Valacyclovir is a registered prodrug of acyclovir. It's converted rapidly and completely to acyclovir. So it is having 70% bioavailability by oral route and half-life is 2.5 to 3.5 hours. Can be given in BD and TID format. Adverse effects are nausea and headache. So it can be used in genital herpes, zoster infections, anti-cytomegalovirus infection as a prophylactic in organ transplantations. Dose is 1 gram TDS for 7 days, 1 gram VD for 10 days. Next is amantadine, rimantadine. So that will inhibit uncoating of viral DNA of influenza A by blocking M2 protein within the membrane and interfere with viral assembly in some states. So rimantadine can be given 4 to 10 times. Rimantadine is having 4 to 10 times more active than amantadine. And when you compare half-life, amantadine is having 12 to 18 hours and rimantadine is 24 to 36 hours. And good secretions in the nasal and salivaries. So when you compare to serum, and it's also higher attainment in the CSF fluid. Amantadine is not metabolized and excreted unchanged in the urine, and rimantadine is extensively metabolized. So both is having same adverse effects, but rimantadine is having less CNS adverse effects, and both will produce GIT disturbances and cholinergics. Side effects, or it will potentiate when anticholinergic drugs are given along with these antiviral drugs. So indicated in treatment and also prophylactic treatment in influenza A virus infections, 100 to 200 mg daily. So amantadine is also used in Parkinsonism conditions. Zanamivir inhibit neuraminidase enzyme. It is a viral glycoprotein. So neuraminidase, it is an enzyme that is important for viral replication and release of the virions. So that will bind to the glycoprotein through salicylic acid. So this enzyme is important for cleavage and release of virions. So inhibiting this enzyme that will inhibit the viral release and replications. So tenamivir is indicated for acute uncomplicated influenza, A and B infections, and flus infections and bird flu infections, H5N1. So it is having adverse effects, wheezing, bronchospasm, cough, nasal throat discomfort. So it is given 10 mg bead intranasally, started within 2 days of onset of symptoms and continued for 5 days. So it should be started as early as period, prevent the its replication of influenza and picking up of its manifestations. Provide that can be even within 2 or 3 days of the infections, onset of infections. Oseltamivir. It is same as zanamivir. Its mechanism of action. It is ester prodrug converted into active carboxylate. It's having 80% oral bioavailability. Half-life is 7 to 9 hours. It is also not metabolized, excreted, and changed in the renal systems. So it is used in acute, uncomplicated influenza A and B infections, bird flu, swine flu infections. And it produces nausea, diarrhea, vomiting, abdomen, that CIT related adverse effects. Can be started 75 mg PD for 5 days. And that should be within 2 days of onset of symptoms and prophylactically 75 mg. Ribavirin is guanosine analog effective against respiratory syncytial virus and influenza A and B, and that is C virus. So it is having 50 to 60% oral bioavailabilities. So fatty meals increases its viability and acid decreases its viability. CSF level is 70% of those in plasma. GIT disturbances, CNS disturbances, reticulocytosis are the adverse effects. So when also it is having severe adverse effects like pneumonia, pneumothorax, hypertension, or cardiac arrest. Teratogenic effects or metagenic effects is also seen. So after taking ribavirin, so their instruction should be given. So women who are planning for pregnancy, that should be postponed or gap of 6 months should be there taking ribavirin. So it is given in aerosol mode in respiratory syncytial virus, that is 20 mg per ml for 12 to 18 hours daily for 3 to 7 days. Hepatitis C infection by oral route. Palivizumab is monoclonal antibody directed against F glycoprotein on surface of respiratory syncytial virus. Prevention of respiratory syncytial virus in high risk in infants once monthly for 5 months can be given. Dose is for 15 mg per kg intramuscularly and monthly. Palivizumab. Lamivudine is nucleoside reverse transcriptase inhibitor for the hepativirus and active for against hepatitis B infections. So this will inhibit DNA polymerase enzymes. Can be given chronic hepatitis B infections or prevention or suppression of hepatitis B infection associated with liver transplantations. So those can be given 100 mg daily. Adipavir dipeoxyl, again it is effective for hepatitis B infections, and also it is effective for herpes simplex, zoster, and cytomegalovirus infections. Half-life is 8 hours, and it produces nephrotoxicity adverse effects and inhibit the DNA polymerase enzyme. Anticavir is again important antiviral drug. So it's having many steps inhibition of uh, viral replications. So it's inhibit the polymerase enzyme, base pair priming, reverse transcriptase, transcription. So that is introduction of negative strand and synthesis of positive strand of hepatitis B DNA synthesis. So various steps it is inhibiting different steps in the DNA synthesis inhibition. So that is having more effective in use of hepatitis B infections. So it's having 100% oral bioavailabilities and decreased by the food. Half-life is 15 hours excreted in the renal system. So it is having adverse effects, headache, fatigue, dizziness, nausea, and it produces adenomas and gliomas adverse effects. Preconaril is effective against picornavirus or enterovirus and rhinovirus. It will bind to the pocket of viral capsids and prevents attachment and uncoating of viruses. So its half-life is 25 hours with the So it is used in enteroviral meningitis or rhinoviral cold. So its adverse effects are nausea, diarrhea, and to some extent headache and abdominal pain. Next, very important drugs. It's having broad spectrum of actions, that is interferons. So it is actually internally released or endogenous proteins. Whenever we have infections, viruses, so these interferons are released and it will boost the immunity so that this whatever viral infection is there, that will be cleared. So that is how immunity will takes action whenever unknown foreign entry takes place. So that is called immunoregulatory. So it is under that influence. So it is having many property or many actions so that inhibit the viral proliferations. They're also having many role in um, immune regulations. So it covers hepatitis B, C infections. So it prevents infections and it's inhibit the proliferations. Simplex, zoster, cytomegalovirus, papillomavirus, rhinovirus. So many steps it will inhibit almost all only except that is protein synthesis that is not inhibited by the interferons. There is different types alpha, beta, gamma interferons. So administration will be in parental route as it will be digested in the in GIT. So we know use of giving through oral route should be administered parental route like intramuscular route, subcutaneous, intravenous, and half life is having 16 hours. And intra-lesion, so wherever lesion is there, there also intra-lesionally can be given interferon. So these are the different interferons list that is covering different viral infections. So interferon alpha A, that is chronic hepatitis B and C infections, capacis of injury cell leukemia, chronic myeloid leukemia. So like that mainly interferons are their different their types and covering the infections. Regulated form, that is new forms, so that is used so that is having less adverse effects on the renal our systems. So that is used for chronic hepatitis B and C infections. Regulated form of interferons, alpha A and alpha B. These are the adverse effects. Their adverse effects. Reduce the blood counts like neutrophil counts RBCs, platelet counts, and they mimic the flu-like syndrome when it is given IV and may produce nausea and diarrhea. So chronic administration may lead to mood disturbances, depressions, confusions, and seizures. So there's the last antiviral drugs which are covering the hepatitis C virus. So you can see that structure of hepatitis C. So it's having different proteins, envelope proteins there, that is E1 and E2, that's glycoproteins. And centrally there is a single stranded RNA is there. Non-structural proteins, they are grouped into different NS2, NS3, NS4A, 4B, 5A, and 5B. So they are non-structural proteins related to hepatitis C virus. When it comes to the non-structural proteins inhibitors, they are the more important antiviral drugs related to hepatitis C infections. The drugs antiviral which are grouped in different structural protein inhibitors like NS3,4A protease inhibitors are boceprevir, telaprevir, cimeprevir, paritaprevir, grazoprevir, galecaprevir, and oxyprevir. And NS5A inhibitors are teclatapavir, rilipavir, omivitasavir, elsavir, and veltasavir, and piprintasavir, and which are inhibit 5B inhibitors, side and tight polymerase inhibitors are sofosbuvir, and 5B nucleoside polymerase inhibitors are dasapavir, baclabuvir. So these are the different antiviral drugs. They are effective for non-structural protein inhibitors. So that first one, sofosbuvir inhibit NS5B polymerase enzyme. So it is having good viability, 80%. It is having 63% class of protein binding. Half-life is 4 minutes. Sorry, 15 minutes. So it's when it enters to the cell, it is our active metabolite is having 7 hours. So when it is given to the because as we know, hepatitis C virus is having 6 genotypes varieties. So it is efficacy increases when it is combined with the other antiviral drugs. So sofosbuvir is combined with interferons. It covers almost all genotypes of hepatitis C virus. So genotype 2 and 3 is effective by combining ribavirin with sofosbuvir. Combination of two drugs. And sofosbuvir can be combined with simipavir, so that will cover genotype 1 and 4 hepatitis C infections. And genotype 1, 3, 4 is covered by the sofosbuvir and lady persevere. And all 1 to 6 genotypes can be covered by the veltasavir combined with sofosbuvir. So like the two drugs combinations covers different genotypes of hepatitis C virus infections. So that will reduce the resistance and also reduce the adverse effects and improve the faster recovery of the patients can be seen by combining the two drugs. That's about the antiviral drugs, non-retroviral antiviral drugs related to its adverse effects, classification, spectrum of activity, and route of administration, different dosage forms, and how the development of different antiviral drugs takes place, and mainly preventing how can be prevented.